Again, dentistry can be very subjective, and the way that everybody does things can be completely different. I'll tell you that I've done thousands of sinus lifts. Every week I do multiple sinus lifts because I also not only just doing individual implants, I do a lot of all on four cases. And on those cases, a lot of times, let's say 30, 40, 50% of the time, I'll also be doing a lateral window sinus lift on these patients. And I do have a lot of experience doing sinus lifts. And in my experience, what I've seen work well is as you do more and more sinus lifts, you can definitely get more aggressive. I don't know if that's necessarily the word in regards to actual number of procedures that you're doing all at the same time. So if you're newer or you're not as experienced at doing sinus lifts or you don't have the predictability when you're doing this type of procedure, it may be more predictable for you to do a extraction and bone graft at first, and then maybe in the future doing a sinus lift and then waiting the necessary 5-6 months of healing afterwards and then placing the implant. If you have a lot of experience and you feel like you have a lot of good predictability, then you can even take out the tooth, do the sinus lift and any necessary bone grafting all at the same time. Now, there's a few other details that come into the equation also of how much native bone you have before you actually hit the what we call the Schneiderian membrane whenever you're doing an extraction and then same time sinus lift. But there's a little bit of variables that come into the equation. But most of the time you can take out the tooth, do a sinus lift and a bone graft at the same time. Now, I will tell patients that one of the biggest factors that I will have in regards to why I would like to wait is I even saw a patient several days ago ask me, she traveled in from out of state. She had a question in regards to she had a procedure done where she had a infected root canal and they took the tooth out and did a simultaneous bone graft socket preservation and sinus lift, which I was thinking probably wasn't the best approach because in my experience, I have seen so many issues with failing root canals, which is why I really, really cannot stand root canals sometimes because they can offer a lot of unpredictability with healing with any dental procedure, so surgery. But anyways, hopefully that can answer your question. But to kind of like sum it up, in regards to everybody having a different opinion in regards to the timing and the whether they're going to do everything simultaneously, that's going to be a subjective answer for a lot of people, and it does come down to experience and predictability, and also just some other factors that people might have in regards to laser infection present, stuff like that.